Welcome to This Just In, the show bringing you the latest advancements in healthcare, strategy, innovation, and public policy. And now, for the fastest voice in healthcare, here's your host, Justin Barnes.
Hello, everyone, and welcome to the special edition of This Just In Radio. I'm your host, Justin Barnes. Today, we're broadcasting live from ViVE2026 in sunny LA. Very excited to be here. It's already been an action-packed 36 hours since I landed. The prominence of this specific show grows every year, and I feel very fortunate to be able to broadcast annually from this event. Rich Scarfo and the entire health team are extremely supportive, and I'm tremendously grateful. I also want to make a special note of thanks to Roberta Mullen and Jake Reed for their support in helping me produce these ViVE broadcasts and recordings each year. They are terrific. This is actually my 12th year broadcasting live from a healthcare industry conference, and they helped make it my best year yet. So grateful for them and certainly my amazing guests. For today, though, I have a fantastic lineup of CEOs, CIOs, care providers, innovators, policy leaders, and visionary. If you miss any of this broadcast, all my shows are from This Just In Radio are posted at Amazon Music, YouTube, Spotify, Pandora, Apple Podcasts, iHeartRadio, SoundCloud, Spreaker, and the TuneIn platforms. As many of you know, my goal for broadcasting live each year from these key conferences is to create an information medium that shares best practices, strategies, and actionable intelligence from the industry's leading sources and experts. My goal, along with all my guests here, will be to offer tactics and strategies not only to survive, but to thrive as you navigate your hospital, your physician practice, your company, or even your family through all of these changes occurring across healthcare. There is more opportunity than ever before for all of us to thrive, but we must understand how healthcare is evolving, how policy and reimbursement is shifting, and where best practices and innovation can support our efforts. I hope you glean all of that over the next few days. That's at least my goal. Welcome back to This Just In Radio Show, broadcasting live from ViVE2026 in sunny LA. I'm very excited to introduce my next two guests and great friends of the show, Dr. Kamal Jethwani, VP of Digital Ventures for Moffitt Cancer Center and CEO of Acceleronc Studio, and Dr. Nainesh Parikh, Vice President and Chief Clinical Expansion and Partnerships Officer with Moffitt Cancer Center. Welcome back to the show, gentlemen.
Thank you for having us.
Thank you for having us.
You guys are great. First of all, I assume we see each other quite a bit through the conference, but you guys had a great conference, great show so far.
Yeah, no, it's been a really good conference. Interesting attendance, I'd say maybe a little bit subdued, but at the same time, the quality, the people here are great.
For sure. Yeah, same. Agreed. Yep.
So we were talking off the air a little bit. Very difficult questions. I know we're gonna have some fun with this. And this is, again, whet the appetite, a lot more to come. We're gonna do some really cool shows from Moffitt, from St. Pete, from Sarasota. So we'll have some fun here this coming year. But start off with you, Nainesh, for health systems. What cancer innovations are most likely to transform outcomes and financial sustainability for them over the next 3 to 5 years?
I'll take the second one first. I think the financial sustainability piece, I think there's two pieces. The topic du jour is AI. I think AI actually getting deployed on the front-facing clinical side and in the back offices, I think are very helpful. Just two quick examples. Mm-hmm. I think the opportunity to create an avatar of myself to answer patient questions when I'm not around is incredibly exciting. Haven't seen someone successfully crack that completely, right, but there's a lot of people doing that work already. In addition, deploying AI to do things like prior auth, to identify clinical trials, the standard stuff, but really actually supercharging that, absolutely, I think are great. And then finally, I actually think AI building models and digital footprints to run clinical trials and to run or identify when patients will respond adversely to treatments has the opportunity to actually transform outcomes.
Love that.
Yeah, so since you're specifically asking about cancer centers are typically sort of treating more sick patients, right? More complex cases. In that case, I know, so in addition to whatever Nainesh said, there are new therapies coming. 30 to 40% of the upcoming, drug pipeline in the next 10 years is oncology. Mm-hmm. So we think that there's going to be a lot of precision medicine coming in. That's going to have a huge impact on outcomes, which we're really excited about. You could get to a point where there's literally drugs being made specifically for a specific cancer in a specific patient, yep, and get it down to that level and then never be used again, right? And that's exciting because that's going to help with cures and it's going to help with better quality of life while you're getting cured, right? So that's exciting. I think on the administration side, Nain covered a lot of it. I also think that the way in which we're getting paid and the way we're taking accountability is changing. So we have a lot of movement on the administration side where they're thinking about value-based care in oncology.
Absolutely.
It hasn't happened successfully before. It's a very difficult paradigm, but they seem pretty interested in it, and I think that could be really interesting in how we align incentives, and I think that would have significant financial outcomes.
Do you see that coming from the feds, or do you see that coming from the private payers, or where's that going to come from?
It always comes from the feds.
Okay.
Yeah, if they don't set if CMS doesn't set the guidelines, nobody else is following.
I totally agree. I was hoping that would be changed. Something's changing, but no, I agree. All right, so now specifically for physicians and care teams, what innovations are giving clinicians new confidence in treating even the most complex or historically resistant cancers?
So I would say two things, kind of along the lines of what I just was mentioning. Mm-hmm. I think the ability to make clinic efficiency higher, and I don't mean clinical efficiency, but I mean reduce no-shows, reduce patients asking questions about where their records are. Hey doc, I had a scan across the street. Oh, I don't know how to get that information into our system. Tools that are actually just making the practice of medicine easier will then allow clinicians to really focus on the delivery of the care, meaning what treatment plans we're going to use, rather than focusing on all the ancillary pieces. And rather than saying, who's my person who does scheduling? Who's my person who's going to go find clinical records? Who's my person who's going to make sure that the records are coming back in? Mm-hmm. I think that's actually going to unleash brain power for doing clinical treatments for complex cares. So that's one piece. Yep. I would also say that, as Kamal was saying, clinicians being able to use more targeted therapies specific to tumor mutations. So as we can diagnose better, as our pathology gets better, as our cell-free DNA technology gets better, I think we can actually target those therapies, and the pipeline gets compressed because of all of our digital tools that are doing that.
Love that.
Yeah, I agree. I think clinic efficiency, clinical efficiency, I think they're both really important. I really think that at the end of the day, the way we practice medicine should be changing, right? Mm-hmm. And so one of the other things that you're asking cancer centers, so I'm going to take us a little bit away from that, right? So cancer centers, great. I think that's well on its way in terms of clinical outcomes. When you start thinking about the community, that is where the problem we're seeing is a lag of adoption of innovations, pharma innovations, digital innovations, all of those, right? And we think that if you can close the gap and even improve the quality that is being provided at the communities, which is where 80% of our patients are being treated, if you increase that by 20 to 30%, you're going to have a significantly better impact on mortality. So as we're thinking about this, the one thing I would encourage all of us to think about is how do we not leave the community out, right? Because 80% of our patients are there.
Yep. Love that. Fantastic. Now, this is very optimistic, but moving to the specific patient optimistic side. If you're speaking directly to patients, which they do listen to this as well, we're all patients at the end of the day, what developments in cancer innovation would give them the most realistic hope right now?
So since I'm going first,
this is an easy one.
I think this is the hard one.
I'm just kidding.
I said it before when we talked that I think the exciting part is that patients nowadays are interested in their own kind of therapies. Mm-hmm. So what I think really represents the most realistic hope is our ability to have engagement for improved screening. I think, to Kamal's point on the last topic, how we're doing screening, how we're doing prevention really needs to be done at the personalized level, not actually at the population level.
Right.
What do I mean?
Absolutely.
I mean the ability to enter in your hair color, your eye color, your family history, your skin color, your sun exposure, your diet, and to be able to do that in a non-cumbersome way to boil up your own personal risk. And I think we're actually going to get there soon with personalized risk models. I think that is actually going to be way more important, so that all of a sudden people are saying, hey, you know what, in 3 years, kind of like Back to the Future, in 3 years, you better be ready to get prostate cancer. So do everything you can right now to improve your urinary symptoms so that when you get prostate cancer, we already know how to treat it, but you're going to get it.
Yep. How far away from that? 2 years, 3 years?
I actually, of all of the things, I'm normally the pessimist here.
Yes, you are.
I think we're less than a year away if we do it right.
Love that. Thank you for that.
So I think, at least in the US, we've always had an amazing infrastructure for innovation. New drugs, new molecules, new treatments. The movements we've had in the last 50 years are incredible when it comes to medical science. What has been lacking so far is the equalization of access, right? And what I think I'm incredibly excited about, and this conference is incredibly excited about, is that we finally have a mechanism to break the cycle of the demand and supply mismatch we've been seeing in healthcare for all this time, right? We don't have enough physicians. We don't have enough oncologists for sure. We're losing 20 to 30% of our oncologists in the next 5 years to retirement, right? And we're not training as many as fast. We don't have the supply. We don't have the brick and mortar. We don't have the physician talent to be able to meet the demands of cancer. And no matter how much incredible innovation comes in, that gap was going to kill us. But I think not anymore, because with AI, we're going to solve it, right? And so what I'm really excited about is finally, we have non-pharmacologic innovation that is going to fix, I think, the demand-supply mismatch so that every patient can get the access to the right treatments that they deserve. And that, I think, will have a much bigger impact than any new drug coming out.
I love it. So I'm going to ask a follow-up question, and a hard one for you both. What's one thing a cancer patient can do, or just a patient that has in the back of their head, so if they have come up with cancer, diagnosed with cancer, they can react. What's one ounce of advice you'd give to them? Start off with Kamal.
Wait, sorry. 1 ounce of advice that we give to them for what?
Someone who maybe personally diagnosed with cancer, or just in the back of their head, if they ever get diagnosed, they have it. They know this because you mentioned on my show last time. I think it's something very similar, very optimistic.
Yeah. Okay.
Give you a chance.
1 ounce of advice. I'll do 3 things.
Okay.
1, keep up your screening schedule, no matter what. Like, no matter how lazy you are, no matter whatever, just don't skimp on your screening schedules. We all know what they are.
Yep.
Number 2, if you do have a suspicious cancer, go to the best center you can find that is convenient to you, right? So go to the highest ranked.
Yep.
Number 3, always get a second opinion. There is a 30 to 50% chance that the second opinion is going to change your treatment paradigm, and that could mean the difference between cure or not.
Yep. Survivorship. Love it.
So I think
optimist.
Right. I think we've talked about this before.
Yeah.
It starts with advocacy. So construct your team. Treat it like a business. So
there you go.
Get the person who's going to coordinate your appointments. Get the person who's there for the TLC. Get the person who's there to be the bulldog. And then go do the second opinion, the third opinion, the fourth opinion. But construct your team, whether it's family, it's friends, it's people you pay, whatever it is. Get the people there that are going to run your life. Because when you're the one that has the diagnosis, and I can only imagine, luckily I've never had the diagnosis myself, you've got to focus on being well.
Right.
So construct your team and knock it out of the park.
Love that. That's a very hard question. You guys both crushed it. Kamal, Nainesh, you guys are awesome. Thank you so much. Appreciate it.
Thanks, man.
Thank you.